Is there any hope for that person that has a C4, C5, C6 disc herniation, has had it for 25 years and is approaching the age of 60 or later on in their life? Is there any hope? That's the focus of today's question and topic of the Ask Dr. Walter video series. And what the series is about is I'll take a question from the comment section from one of my videos on my channel, and I'll answer that question in a video format just like this. So by leaving a comment or even a question, you may be featured next in answering a question on this video series of Ask Dr. Walter Cerebral. So today's question comes from Robin, and this is what Robin asks. By the way, this is episode 29. So Robin asks, I've had neck pain for 25 years now, and I'm almost 60. I had herniated discs, C4, C5, and C6, but now just a bulge. Is there any hope for me after this time at this age? And that's actually a very good question and a very fair question, Robin, and anyone else that's in this situation. You know, as you're approaching the later years in life and you know that you've had a ton of degeneration on your spine and have suffered through that over the years, the question is, you know, what can be done at this point? Is there any hope? And I always believe that there is hope, but your goals and your results that you expect and your outcomes have to be realistic. So if you're doing exercise or chiropractic care or physio care, you have to understand that you're not going to ever get your spine to the condition and shape that it was when you were in your 20s, okay? So that's not possible. So there's always a limitation in matter. So if there's a lot of damage, disc herniations, now they're bulges, that's a history of spinal damage and decay and degeneration over the years. Having said that, I truly believe that with care such as corrective chiropractic care, chiropractic adjustments, even exercise and even physical therapy, that you can actually improve from the level that you are, the function of your spine, the mobility of your spine, the relaxation of muscles, and even some posture. Okay, so you may not get it to the shape and to the condition that it was when you were in your 20s, but at least you can improve in some aspects with relief of pain, relief of muscle tension, muscle spasms, postural positioning, stabilizing so it doesn't progress and get worse, improving the spinal function and the movability of each individual joint areas. So I do believe that that is possible. This is a general answer, okay? I'm not answering specific for any one person, including the Robin who asked this question, because I haven't examined Robin, I haven't examined you or anyone else. But in the situations where I've seen many patients in the age group, I have seen them improve with their range of motion, their posture, their muscle tone, their level of pain, and their quality of life. So I've seen all that happen, okay? Even though the condition of their spine and the degeneration of their spine cannot be reversed back to when they were 20 years old, for example, okay? So there's always hope. I think what's important is to do something, to be active. So whether it's home exercises, mobility, stretching, strengthening exercises of the cervical spine and neck, getting chiropractic assessment, chiropractic examination, spinal x-rays, doing corrective chiropractic care, I think that's part of the process as well. Just leaving it alone as is for the next 20, 30, 40 years, you know, it could possibly continue to decay and degenerate faster. But if you do something to support and stabilize it, then potentially you could at least slow it down and enjoy a more comfortable, active quality of life. So great question by Robin. I appreciate that. And if you want your question answered and featured in the next episode of Ask Dr. Walter Cerebral, do leave a comment or a question right now on the comment section below, and stay tuned for more of these uploads. They are going to come pretty regular as well. And if you missed any of the past episodes, just go right there at the playlist. I know you see it right there. Click right now on that playlist and you catch some of the past episodes of the Ask Dr. Walter Cerebral video series.